This is Ernie Williams, a 40-year-old African-American male who has difficulty controlling his hypertension. He has had hypertension for approximately 11 years, no other serious illnesses, excluding pneumonia 6 years ago. He also has a family history of hypertension. Although his hypertension is serious, Ernie fails to make any lifestyle changes. He drinks several beers every night, doesn't watch his sodium, fat, or carbohydrate intake, and does not exercise daily. Ernie, your blood pressure is still elevated at 155/96, and you seem to gain 20 pounds since your last visit. There is also presence of albumin in your urine, indicating kidney damage. You also have high cholesterol and high triglyceride levels. It is often more common for men over women to have hypertension, and it is even more common in African Americans, especially at a younger age, in comparisons to Caucasians or Hispanic American adults. Lifestyle habits greatly affect the course of hypertension and include habits of lack of physical activity, increased alcohol consumption, diet, stress, and family history and genetic causes. It is important that Ernie make some lifestyle changes.
Symptoms usually aren't detectable until the body becomes damaged from high blood pressure over time. The comorbidities include complications such as micro and macrovascular disorders. The macrovascular complications, which are well recognized in patients with long-standing hypertension and diabetes, include coronary artery disease, myocardial infarction, stroke, congestive heart failure, and peripheral vascular disease. Hypertension can also lead to aneurysms, chronic kidney disease, eye damages, and cognitive changes, including memory loss, difficulty with vocabulary, and loss of focus.
Some of the main mechanisms driving his hypertension is the RAS system and his high sodium intake. Drugs that he should be taking to drive his hypertension down is exercise, stress management, an ACE inhibitor, diuretics, a beta blocker, an antihypertensive drug, a calcium channel blocker, and a vasodilator. Underlying medical conditions like congestive heart failure and diabetes are a contraindication for exercise. During aerobic exercise, blood pressure should not exceed 260/120 millimeters of mercury because of a heart attack, stroke, or an aneurysm that can result from exercising too hard with high blood pressure. If isometric exercise is required, such as in a core conditioning or core strengthening exercise, it is highly recommended to breathe while exercising.
Hey, Grandma, what's up?
Hey, your face is so small. Hey, kiddo, you know you really should talk to your dad. You haven't spoken to him in like 4 years. And he's very lonely after the death of your mother 5 years ago.
No, but Grandma, he's such a loser. He's 40 years old, he drinks beers all day, he adds salt to every food that he eats, and sitting around in his butt all day is the reason he got high blood pressure in the first place. I saw a picture of him the other day. He's gotten at least 20 pounds fatter.
You know I have hypertension, and so did your grandfather.
Yeah, but even his job requires him to just sit around in his butt all day and direct air traffic. Like, come on. I'll talk to him when he gets on some daily activity routine and actually starts dieting. That way he won't feel short of breath from just walking up the stairs.
Okay, honey, I will talk to him. I know he's seeing a doctor, but you gotta be nicer to your father. You understand?
Okay, maybe.
I'll talk to you soon. Now, how do you hang this thing up?
Okay. If you just press the red button. I love you, Grandma.
Love you too.
Hypertension. Why? Salt, beer, and sugar. Oh my. Stop while you're ahead.